Welcome to a episode of our Spinal Correction Spotlight. I am Dr. Romar Rochet, and in these spotlights I'm trying to showcase not just the improvements that people experience through chiropractic care on their pains and symptoms, headaches, things like that, but more importantly, the effect that subluxation correction on the spine has on its alignment, and then as that alignment of the spine improves, how the person's quality of life also improves because the system starts to improve. And in this video, I'm going to be talking about a current patient who is going through another corrective care plan. We initially started with a 3-month care plan on him, and we are now, after doing our follow-up x-rays, continuing through a secondary corrective care plan. All the indicators both on table and on x-ray show that he was going to experience and receive some benefit by going through another corrective care plan. And so that's what he decided to do. Now, a corrective care plan is different than a maintenance care plan. Correction is usually a higher frequency. Think about braces for teeth. Every time those braces get tightened, those teeth are being pulled in the right dentition, right? So that's happening over a time frame. And then after the braces come off, then we wear a retainer. And that retainer is to protect the progress, the gains that were made using the braces. So from a chiropractic perspective, a corrective care plan usually requires about twice a week, depending on the case, maybe 3 times a week. And after we do our analysis and our assessments and see how the person is behaving on table, are we seeing improvements in their spinal stability? Are we seeing improvements in their subluxations and how long those subluxations are maintaining themselves? Then we graduate them to a maintenance program, which usually is anywhere from once every 7 days to once every 10 days, depending on their ability to hold their adjustment, with the intent that we're going to try to continue to push that on longer and longer to find that space where they're able to hold their adjustment the longest before they subluxate out. That's really where the body is able to best express its greatest innate capacity. That's where that person is usually experiencing the highest quality of life, being able to engage in activities of daily living that make life worth living. And that's where the crux or the benefit of chiropractic, in my estimation, is that we are helping the body express its innate healing, God-given capacity. So this is why we adjust subluxations. We just don't crack spines, right? So in this patient's case, he was referred to us from existing practice members, his family. And our initial x-rays, which you see here, show that he's losing his spinal curvature, right? His lumbar spine should follow that green line, and the red lines represent where he is exactly at that moment in time. And the problem with losing curvature is that the spine loses its ability to deal with stress, physical stress. Usually in about 80% of the cases, lumbar dysfunction has some type of emotional component as well. So if you're experiencing a lot of emotional stress, there may be a component to that as well. But the further that you lose curvature, the further out of alignment your lumbar spine becomes because of a subluxated or subluxated bones, the less able it is to deal with physical stress. So you can imagine picking things up, right? You're not as stable, and therefore greater likelihood of injury. That also starts to increase the stress on discs, so they start to wear away a lot faster. And it starts to cause stress on bones, which means now you've got degenerative changes on bones, usually related to or called spondylosis. And that degeneration creates permanent changes in the bones, which once those permanent changes start happening, things like osteophytes, those things are, again, permanent, and you can't recover from that. So subluxations do more than just cause nerve interference, which is their primarily greatest effect on the system, but they also cause physical stresses that cause accelerated degeneration within the discs, within the bones, and then how all that affects the surrounding tissues. So in his case, he has a physical job. Not only does it require him to travel long distances, but lifting and stocking shelves and things like that. So his spine was suffering from severe stress. He was having problems sleeping. He was having problems taking deep breaths in, pins, needles, tingling, numbness, and weakness into his hands. He was starting to have the same type of what's called paresthesias going on into his legs. And I mean, this is a relatively young guy. So for someone to experience those types of things at his age, although it's common, it's not normal. So because of the fact that he was coming from about 30 minutes away, passing by a couple hundred chiropractors in the process, we wanted to be sensitive to that. And so the spine changes usually in about 90 days is where our first care plans start. So we decided, let's just go ahead and do an initial session. Let's see what type of correction we could have within those 90 days. Let's see what type of quality of life improvements you realize outside of the adjustments. And then we could determine whether or not we can graduate him to a maintenance care plan, or if we needed to do another corrective care plan, if that was necessary, then we would address that at the time of his reevaluation. And so at the time of his reevaluation, as you can see here, his spinal curvature improved drastically. His curvature came back to where it's supposed to be. In other words, his hips and everything actually, center of gravity changed, and now his upper body was well within his center of gravity over his lower body. That started changing a lot of the issues that he was having systemically. Some of the digestive issues he was having started to resolve completely. The biggest thing for him was that his mid-back, the one that was causing him so much discomfort, where, taking deep breaths in was a problem. Again, some of the paresthesias into his hands, that was some of the other problems. We finally started to get movement in there. And in discussing with him, besides his history of some injuries and whatnot, his mid-back had gotten so locked up as it was compensating for the changes in his neck and his low back, that's where all that stress was really being applied. That's where his symptoms were really coming into play. And towards the end of his original care plan, we finally started to get some good motion in between those bones. His adjustments were starting to get a little easier. And so we take that into account. We took his improvements on table, his what's called his leg length inequality, where his feet were when we first started compared to where they were at the time of his reevaluation. He wasn't exactly balanced yet, indicating that he still had some subluxation nerve interference in his system, but the approximation, how close his heels were getting as a reflection of functional improvement, was drastically improving. And so he decided, as a sacrifice, to continue with another corrective care plan, because not only was he seeing the benefit on table, and not only did we see the benefit through his x-rays, but he was seeing the benefit in real life. He was able to do his drives, his deliveries and whatnot without the pain that he was experiencing. He was sleeping better, digestive system improved, he was breathing better, he was able to take deep breaths in. The paresthesias, the pins, needles, tingling, numbness, weakness into his hands had completely resolved. And those are indicators that he was healing. So could we have gone to a maintenance program? Sure, we could have, because correction continues. As long as you're getting adjusted and as long as you're getting your subluxations corrected, correction continues. But just like going to the gym, you go to the gym 3 times a week, there's going to be a difference in your overall outcome compared to going just once a week. So I'm looking forward to having a follow-up to this video, because of the fact that we are right in the middle of another corrective care plan for him, and I want to see and I want to showcase exactly the changes of what an additional care plan, a corrective care plan, will be for him from a spinal perspective. So I hope this video, and I hope seeing those changes, real life changes, not just structurally, right, not just from a spinal perspective, but hearing about his changes physiologically and what that means for him in real world application. I hope that gives you some encouragement, and I hope it showcases and shows you that chiropractic is not just about pain. That might be what a lot of people come into care for. But when they start to see their bodies function better, when they start to see their immune systems improve, when they start to see digestion, cardiovascular function, headaches, for example, acid reflux, when all those things start to improve, it's because the system is improving. It's because your body is expressing health. It's because your innate intelligence is finally able to express itself the way it should, without the inhibitory effects of a subluxation blocking its ability to control and coordinate every function of your system. And that's really where the crux of subluxation-based principle chiropractic has its greatest power, is in helping the individual express their God-given potential for life and healing in a way that is supportive of health. without drugs, without surgery, without anything from the outside in. It's what the body's doing on its own. So I'm looking forward to really producing more of these videos to continue to showcase what subluxation-based corrective care can do, what its effects are, and hopefully that continues to encourage you to, even if you're not in pain, even if you're not having any perceptible symptoms, to get checked by a subluxation-based chiropractor, because they may help you, they may be able to help you really continue to compound improve your current expression of health.